Hello, everyone. My name is Tiah Tomlin, and I'm a graduate of the Living Beyond Breast Cancer's Young Advocate Program. I'm working with LBBC to ensure that their programs include diverse voices of people impacted by breast cancer, including some focused programs for African Americans. Living Beyond Breast Cancer is excited to be offering a workshop series for African Americans diagnosed with early stage and metastatic breast cancer this fall. The workshop series will help attendees become more informed about their care and provide actionable tools to address implicit and explicit bias in the healthcare setting. More information and registration information will be available this summer. To learn more, make sure you're signed up on LBBC's mailing list. In 2015, I was diagnosed with triple-negative breast cancer, and after going through my journey, I wanted to be a part of the solution. So I decided to become an advocate with a focus on addressing issues around disparities in the African American community. Today, I'm now supporting over 500 women who are living or have lived with breast cancer in the greater Atlanta area. I'm so excited that we will be talking with Celeste Vaughan-Briggs today. She is a licensed clinical social worker at Thomas Jefferson University Hospital. Ms. Vaughan-Briggs works at the Sidney Kimmel Cancer Center, where she practiced trauma-informed social work. Welcome, Celeste.
Thank you for having me.
Yes, I'm so glad to have you. And I'm so glad for us to have this conversation today because it is near and dear to my heart around disparities. So I want to ask you, you practice trauma-informed care through your social work practice. What does that mean for Black women with breast cancer who come to see you?
So thank you again for the opportunity to talk about it. And what I'll do is just kind of give a general overview so that we can understand the context. So if we think about ourselves, right, and we think about the approach to any issue, social workers tend to approach things with something called a biopsychosocial approach, right? So it has our biological issues. That's the things that we bring to the table, our gender, any physical health issue that we have, our stress reactions. Then we bring our psychology. That is, how our attitudes, our beliefs, how we respond to issues. And within that can be the impact of trauma in our lives. And then we have our social context, our family systems, our cultural backgrounds, our racial backgrounds, our community. All of those things kind of intersect in the middle for our health. And if we are looking at the whole person or the person in the environment, what we do know is that in the United States, just generally speaking, there are many, many people who have been impacted by trauma. And if we approach that with universal precautions by coming to the table with a sensitivity, with an understanding of these facts, then we're better able to meet people with the appropriate level of services, care, respect, and meet them at their point of need.
Now, would you say your approach is different from the traditional approach to treatment? And if so, how so?
What I would say it's nuanced. Trauma-informed practice has been amplified by several different community spaces over the last 20 years. It certainly needs some additional penetration into the community, but what it does is allows social workers, care professionals, and others to approach individuals who have experienced a medical trauma, which the diagnosis of cancer is, even in circumstances where the best possible outcome that the individual impacted by cancer, their family, and the clinical team wants, it's still a significant issue in that person's life. It could go everywhere from an acute stress issue to anywhere from a full trauma response. So if we approach that as a care team with that understanding, we're better able to contextualize people's reactions, respond appropriately, and meet them with the services they may need and supports they may need along the way.
So, you talked about what it's like to have breast cancer while being Black. Now that we're dealing with this COVID-19 situation, It's well documented that African Americans are disproportionately affected by COVID-19. How does this contribute to those stressors or the anxiety and trauma?
That's a good point. I think one of the things that we're finding is that it's amplifying anxiety, concerns, issues about distrust in the medical system and healthcare professionals, as well as generalized anxiety about the balance between those things we can control and those things we can't control. And for a cancer patient, and particularly cancer patients of color, there may be more concern to bring to the table. And one of the things we can do as care teams is be sensitive to that, acknowledge that, don't run away from acknowledging that, and then listening to the concerns of the patients and bring to the table and see, can we strategize a way to help control the things we can, and as care teams and as providers, and help patients and their families control the things they can, and then all of us walk through this together in a more informed and sensitive way.
It's interesting, we're sitting here, we're talking about, the coronavirus, COVID-19, and, people with breast cancer are being treated differently than usual. We're seeing situations of delayed surgery, reconstruction, then pushing back when you start your chemotherapy. And, I'm even seeing it with the women that I support, just the high levels of anxiety. And with these changes, we know that they can actually exacerbate distrust in the healthcare system. How can we actually be sure that our doctors have our best interest at heart?
So thank you for bringing up that question, because I think that having the conversation about it and acknowledging it is important. While we understand that healthcare systems and providers are trying to deal with unprecedented times and things being different than they were or would have been prior to the coronavirus pandemic, we still want to encourage women and their families to advocate for themselves and to communicate concerns. Sometimes having a system for that, maybe in the past, it was easier to communicate because you had a face-to-face visit. There was a little bit more time to be able to discuss concerns. But now with the telehealth visit, maybe the time is shortened. So utilize the technology, write down questions. Can you submit questions early via MyChart or whatever electronic communication that your provider is doing to ask them to respond about why they're doing the things they're doing? What is the concern? What is the overall picture they can give you about what these changes mean? It doesn't necessarily mean that you're going to feel more trustful, because there are some uncertainties, but at least you can feel a little bit more empowered that you have gotten answers to the questions, or at least attempted to get answers to the questions from the providers. And they should welcome that because that helps them to be clearer and to communicate uncertainties or certainties to you as well.
Yeah, we're talking about advocacy. Advocating for yourself is so important. We can't stress that enough. And now with people having to go back to work and they can't shelter in place and things are opening up, the levels of fear are just going off the charts now. I'm seeing it. I'm sure you're seeing it. People are concerned about getting COVID-19 because now their exposure is increasing. And what we're also seeing is that people who are done with treatment are being told by their doctors that they're not immunocompromised and they're not in the high risk category. But we know that there's so many unknown factors with this disease and this virus. How can we help these patients or just women, whether you're in treatment or out of treatment, and men, how can we encourage them and help them communicate to their doctors to receive the information that they need to help ease their fears?
I think some of that is working with organizations like Living Beyond Cancer and other organizations that have collective concerns, talking to others, other survivors, so that if you feel that on a one-on-one basis your concerns aren't being addressed by your clinical team, you can have a shared collective voice. And if there are issues or concerns that are really coming across as very common, maybe that collective voice can then translate to a little bit more media attention and we can get some things addressed. Understanding that there is some differing information kind of going back and forth. For many years, women were told to have a certain type of follow-up in a certain type of order, and that was important. And now, organizations, clinical organizations are saying, well, no, we can bend those guidelines, and some doctors agreeing and not agreeing. So maybe if we can get the folks who are impacted by some of those changes and their voices and concerns collective, and then we can get the clinicians, maybe we can have better communication between both parts so that we can have a good way forward, because it seems like, unfortunately, the pandemic is going to be around for a while. Even if we were to find a vaccine, the impacts are going to be felt for quite some time.
And we talk about having the conversation with our healthcare providers, but what about in the workplace? What are some ways that we can advocate for ourselves with our employers? And I think there are also some concerns of not revealing too much about our health, but we want to make sure that we are protecting ourselves and our companies do take us serious. How can we make sure that our voices in the workplace are being heard and we're not being viewed as some type of threat?
So usually what I advocate, there are a couple of things I usually advocate for patients for concerns in the workplace, just generally, and then we can say specifically for this. One is locate your agency's or your employer's policy, procedure, HR manual, because you need to know what their rules are first. Second, if you find that there is a concern about how you're being treated, if you're being treated unfairly or being put at risk unfairly, there are some legal advocacy organizations that your social worker or you can connect to if you have to fight for certain protections. We have, the Family Medical Leave Act, but that has, its place for certain circumstances with certain employers. Sometimes the law is a little bit more nuanced and it can vary from state to state. So it's very important to check into your local advocacy organization. But the first step is getting your own policy and procedure manual from your HR department so that you can have guidance about what your specific employer's rules are so that you can know for sure how to navigate. And that is what any legal advocate would want to know anyway, in case you have to fight for additional protections or accommodations.
Great. Thank you for sharing that feedback. And one other thing I want to bring up, since we're talking about, employers and we're talking about having the communication with our healthcare providers, here in Atlanta and many other parts of the country, we're starting to go back into public. And one of the things that was concerning in particular, the state of Georgia was one of the first states that actually opened up, and the places that they opened up were places that people of color or Black people tend to frequent, your hair salons, your barbershops, your nail salons, bars. And, with all the tabloids and, the headlines coming across saying, hey, African Americans are disproportionately affected by COVID, it was like a slap in the face for people of color for those places to be open where our community, like I said, Black men and women, we frequent. It wasn't like golf courses were opened or other places that other ethnicities frequent. So what kind of information can we share with the community that will be helpful and provide them with the level of support that they need right now?
Great question. And this is it's a difficult and sensitive topic when we start talking about health disparities, and because this is a novel virus, we don't know all of the impact and some of the early information that's coming out. As somebody who has had a long interest in health disparities generally, and specifically health disparities in cancer, I think it's important for us to be nuanced and mindful of the information we're receiving right now, and how we use that information to inform our actions. So on one hand, when we have health behaviors and things that are risky in the environment that we live in, whether it's a secondhand smoke or it's being exposed to chemicals in the air, incidences of higher asthma, what do? We inform ourselves, we get the information, we take the best steps we can to personally protect ourselves and our loved ones, while at the same time trying to get a sense of the picture, get the data around us so that we can mitigate as much risk to ourselves and loved ones as possible. And it's always kind of about balancing that out. And I think that that is a smart strategy. It allows us to be able to have some predictability and control. So if the guidance is hand washing, wearing masks, socially distancing, those are things we can individually control. We can't control what other people do in terms of their risk behaviors, but if we mitigate as much as we can, at least we can know at the end of the day we've done the best that we could do in those steps, while at the same time making sure we're pushing to get good data out there so that people can make better decisions. Because some of this conversation is not necessarily reflecting the risk to all populations because it's so early, right? We're getting a picture here, a picture there. At first, we thought that children, but the data was showing that children weren't necessarily impacted to the degree as adults, but now we're seeing that that information is absolutely different, and we're seeing it globally. So I think that maybe, hopefully, as people get better information, the more cautious approach will rein in again, and people will take their health risk behaviors more seriously. But we can do what we can do for ourselves and our families.
Yeah, I'm going to change the topic just a slight bit. You know, one issue that I've noticed, and this is before COVID, is it's harder to get pain medications. And now that we throw COVID on top of it, you know, it now is putting us at risk of the exposure for the virus. So is there anything that we can do around this situation to ensure that patients are getting the pain medications, but they're not having to drive all over the place to find it, putting themselves at a greater risk?
Excellent point. So part of the attention to the opioid epidemic and some provider misuse generally has limited the number of places that folks can access pain medication. So an unintended consequence of actually addressing another health issue. So what we usually tell our folks, though, is to try to get their prescriptions with their hospital systems for a few reasons. One is many times the prescriptions, if possible, can be electronically delivered because it's within that same hospital system. So you're not going up to pick a script up from one office and then going to another pharmacy. And then trying to see if the pharmacy that's associated with the hospital actually has a pharmacy on site that can fill it, and trying to coordinate that for when you're already on that campus so that you're minimizing trips, you're having as much done electronically as you possibly can, and you're trying to navigate the system more effectively.
When we look at our healthcare system, we see that our healthcare system is stretched, and we know that it's going to continue to be stretched. What is it that we can say to patients, or what is it that you can say to patients to help them ensure that they get the care that they actually need?
So it's back to that advocacy. It's back to networks, organizations like LCSW, survivor networks, kind of the ear to the ground in the community about what's open and what's not. Health systems are starting to bring some services back online, but it's going to look quite different than what it did prior to the epidemic. So working to try to make sure you're in the queue to get back on track with regular preventative care and anywhere diagnostic care. I would say look to some other local community organizations. We do know about the digital divide. We do know that some people don't have the technological resources, tablets, iPads, computers, or things of that nature. Some systems are getting grants from either nonprofit organizations, pharma, some cable companies to actually help people decrease the digital divide and getting devices out, which may, again, help you be able to navigate, to find resources and get back in the queue and get the services you need. We are going to have to, eventually some things can't be done remotely, so they are going to have to be in person. So how can we make sure that you're informed about getting back in your doctor's office, getting the test that you need, your mammogram, your ultrasound, your clinical breast exam, and any other services you need.
You know, Celeste, I'm so glad that you addressed this issue around disparities and the lack of digital access. I was actually going to ask you that question, so thank you so much for bringing that up. One of the things that we're seeing is, you know, we talk about disparities and we know that this is a issue that people do not have access. What are some resources that we can share with people where they potentially can get access? Do you know of any?
Yes, actually, in our health system, in our oncology service line, through some private foundation support, as well as some commitment from our health enterprise, we have made tablets available for patients, iPads, as well as phones if they need it, as well as paying for digital minutes, as well as phone bills, and even some internet support. Although we do also reach out to other partners, there are some initiatives by our local cable provider to provide free access. So we, as the social work team, kind of make sure we're connecting up patients to those resources. The other thing, and patients can find out their health system has the same thing. We also have a telehealth task force. The Jefferson Health Enterprise invested pretty early in telehealth, surprise, and it really has turned out to be a good investment. But everybody is not technologically savvy. So we have individuals who can reach out, walk people through setting up their electronic medical record or MyChart account, helping them to figure out how to actually do a telehealth visit, how they work their camera, and or work through any of the technology that we're able to give them through some of this private foundation support. And so it's been really, really helpful, and been able to make sure that we're getting patients connected, even when technology isn't always available or they did not have it prior to the crisis.
Awesome. That's really great. One of the things that we have in Atlanta, and I'm sure it's elsewhere, is our public libraries. They're actually offering routers or hotspots that they are giving out for about 2 weeks for people to check in and check out. So this is great information. And I hope that the people who are actually listening to this share this information with the communities that they support so we can make sure that we get the information into people's hands. Ms. Vaughan-Briggs, I want to thank you so much for speaking with me today. For those who are still tuned in, to continue the conversation about race, breast cancer, and COVID-19, please join our closed Facebook groups, Breast Cancer Support, All Ages, All Stages, and Breast Cancer Support for Young Women. We'll keep you updated on plans for our symposium and plans for future conversations about breast cancer and Black women in the future. Thank you for tuning in.